it's lovely to be here. And as I say, thank you so much for the warm welcome, Maureen, and thank you so much, Gemma, for setting everything up. My hope today is to talk to you about a few different themes that I hope will be of interest and relevance and of help to you. And I'm more than happy to field questions as we go, but I will definitely leave some time at the end for any reflections or questions. So I suppose when we're talking about something like keeping well and coping, I think it's really just important to acknowledge that we just take a bit of care of ourselves during this talk. Some things, might touch us in ways we might have a response emotionally. It might, link to experiences that are, aren't the easiest. So just keep that in mind and go easy on yourself as we think about the different topics and maybe in the context of your own experience. In terms of today's content, I was hoping to cover a few things. Initially, I think it's important to really start with, well, why are we even talking about coping? Why is it important to actually pay attention to how we might mind ourselves and how we might cope with our health, and in particular lung fibrosis. I also want to pay a bit of attention to maybe some of the typical challenges that people might face when living with pulmonary fibrosis, lung fibrosis, and I'm so conscious that there's so much expertise in this sort of virtual room in that area, and you know a lot more about it than I do. But I suppose I'm drawing on what I experience in the clinic room and what people can tell me. In that, it's also really important that we might just take a bit of time to understand stress and how we manage maybe challenge and potential difficulty. So I'll spend a bit of time thinking about that, and then how we cope. What do we typically do? And I'll pay particular attention to, I suppose, that kind of adaptive coping and how we mind ourselves and self-care. And towards the end, I'll take a bit of time to guide you through a self-care practice, something you might be familiar with, something that might be novel. So good to maybe bring an open mind to give it a go if you wish. And then I want to leave you with some information about not only how you might recognize maybe some of the red flags if, say, you're having difficulty with managing. So just being aware of some of the kind of typical red flags that are good to kind of not ignore. And then also think about, well, what help might be available. And I'm conscious that I'm speaking to you from Dublin and the Mater Hospital, and we maybe have certain resources here that might be different across the country. So just giving you some kind of broad information about that. So to maybe start then with just thinking about the different points in the pulmonary fibrosis journey. And I think it's probably helpful to think about this just in the context of why it might be important to think about how we manage chronic health conditions. Because we do have a lot of evidence now that when people have to manage an ongoing health difficulty, such as pulmonary fibrosis, it can throw up potential challenge. You only have to think of the potential symptoms that people have to manage, things like breathlessness, fatigue, weight loss, things like having to get our heads around what that means in our life, how that might impact what we're able to do, what help we might need, what treatments we might need to take in terms of medications or therapies. So there's a lot there to take on board, I think, to say the least. And it's worth flagging that so many people show up to that every day and cope really well. But when we have to show up every day to something that's maybe not easy, that can be distressing, it just can leave us maybe a little bit more vulnerable to feeling anxious, feeling low, feeling stressed. So it's definitely not a given, but there's just potential for that. Um, and that in and of itself is challenging, and then it can also have a sort of double-edged effect, because it can then make it potentially more difficult to engage in how we take care of ourselves when we have an ongoing condition. And in the work that I do clinically as a psychologist, it's such a privileged position to be in, because you get to meet lots of different people and you get to hear people's stories. And in my work, I hear about people's experience of living with pulmonary fibrosis, and I hear that at different points in the journey, there can be potential for challenge, so understandably, you might think at the beginning, or maybe near the beginning, when we experience a diagnosis of pulmonary fibrosis, that can be a challenging time. For some people, unfortunately, they might have had a really difficult journey to diagnosis. It might have been a challenge to get to that point in terms of getting appointments or being taken seriously, or dealing with difficult communication. For some people, that's not the case. For some people, it's quite a relief to have a name for what's going on. So there's no definitive experience. Everyone's experience is different, but sometimes, I think it's definitely a point where it can be a challenge for people. Managing diagnosis. And I think it's worth just saying, and particularly, for those in the audience, if we're kind of in that space, that it's really quite normal to have a number of different emotional experiences as we take on board new information and try to adjust. So there might be different ways of emotion in terms of anxiety, worry. We might be angry, annoyed, irritable. We might feel quite sad and low about it. We might feel relief that we have an aim and there's a plan. So, it can be really different for different people. And I think it's important just that there's validation in whatever that swirl is for you. At other points, I think we have the potential to kind of rub up against challenge, and with other people I meet, it's not so much diagnosis hasn't been maybe difficult, but it's maybe more as symptoms progress that can be a challenge for people, as people maybe manage more of a symptom burden, or and what that means in terms of treatment regimes, how we might brush up against thoughts around our own mortality, and treatment plans. There might be more of a need for oxygen therapy, and what that can throw up for people, that too can be potentially challenging. It can also be a positive piece where people can feel here's something that can facilitate maybe independence and engagement in cherished activities, but for others it can be really difficult to manage the therapy. So these are different points that can be challenging in different ways. And for other people, I think it's not even the lung fibrosis that's maybe the main focus or current concern. Sometimes it's maybe more about this is coming at a time in life where I didn't maybe expect it, or I'm trying to deal with other commitments or life events, because life goes on. We have things happening, needs in terms of family life, caring, work, commitments, bereavement. So, often these are the things that might be the challenge. So I think there's something about just recognizing the reality that it can look different for different people, but that really understandably there can be added potential challenge when we're managing something like lung fibrosis. And I wanted to now speak to you about, I suppose, how that might be felt in the body, and just thinking about, I suppose if we think about a new diagnosis or an ongoing management of particular health condition, it's not unusual that that might be experienced as a stress or a threat in our body, and it can be useful to kind of have an understanding of how that impacts, so that we understand that regulatory system that we all have as human beings, and not only as human beings, but I suppose as mammals, as we can see from the picture here of the lioness and the zebra. Um, that sometimes when something really difficult happens, that can get us into, a lot of us might have heard of that saying, fight or flight. So it activates that threat system that we all have, that is really designed to keep us safe. So ultimately it's designed to encourage our survival and maximize our survival. So the idea of something happening that's difficult, it activates that stress system and might get us into fight, which is about, if we can take on that threat, we get, maybe anger might be more the emotion, we get big and get assertive, and take that on, and we get a shot of adrenaline, noradrenaline, cortisol, the stress hormones, to kind of get us activated and get us in a position to take that on. But more often than not, and if we can't take on that threat, we might get more into flight mode. And as you can see there with the zebra, is something life or death, like this attack of a predator. She's getting those same stress hormones to get her going and get into flight mode and get safe. And this is all happening in a very kind of split second automatic way. And I suppose as we've become more trauma informed, we know that it's not just fight or flight, actually. We might also get into kind of freeze mode, where I suppose if we had this experience of a life or death stress, or a life or death kind of threat, and where we can't fight it, so we can't get into that zone, we can't actually escape, then we might get into freeze, where we don't really know what to do, and it might seem like, why are we talking about animals and predators, and in the context of pulmonary fibrosis? But sometimes a big health event can be experienced as such, and I suppose the reality of the kind of emotional regulatory systems that we have as human beings is, like I say, they're set up for survival, so it's very much about how do we keep ourselves safe and survive. And the other point is that we have this sort of emotional regulatory system that unfortunately hasn't kept up with modern life, where we can be caught and put into this sort of threat mode by experiences that are not necessarily life and death. So some of them can be, or may potentially be, but sometimes we can also get into this space when, we're stressed, we're getting an onslaught of 24-hour news, or there's a load of traffic, and how do we get home in time to meet the commitments that we have? And that can often kick us into this sort of fight or flight kind of freeze sort of experience. And I guess when we have maybe an ongoing challenge that maybe we're having to make space for in our lives, like a diagnosis of lung fibrosis, it can sometimes be experienced as such. It's another load to carry. Or it also, I suppose, in the context of our breathing, another reason why it's useful to know this is, we might, I suppose, potentially get into that sort of threat mode when it comes to our breath. because when we might experience things like breathlessness, it can be quite a physiological just occurrence that when we get into breathlessness, we might get into that sort of threat mode, because in and of itself, it can feel quite threatening, and that might tip us into panic. So to maybe illustrate that as an example, there can potentially be a spiral that we can get into that can lead us to maybe increased anxiety in this example of, like, if we have an experience of shortness of breath, which is a really classic and key symptom. When we're not getting a breath, that can maybe lead to quite negative thoughts. We might think, oh, I can't breathe. What's happening here? Am I going to be okay? If we're thinking things like that, we're going to feel anxious. It's going to get that adrenaline going, that we're going to get into that threat mode, and that then the body is going to have a response. The muscles tense, the heart beats faster, and then that can then influence our behavior in terms of maybe thinking, how I maybe need to pull back from that so I don't get into that situation again. And some of that can be completely understandable, but sometimes things can then take a bit of a negative spiral where if we pull back and do less, then that can sometimes reinforce the negative thoughts, and also not give us that experience of maybe doing things that might give us a different experience. So there's potential that we can get into that sort of experience that can, if left unchecked, lead to a negative impact on our mood and our mental health. So what can we do? If we think about coping, I think often an important place, and often a place I start with people I work, is to think about, well, what do you usually do? What usually works for you when it comes to managing difficult experiences? Because often, when I'm meeting people in the clinic room and, we're talking about their current situation around their health, it's guaranteed it's not the first challenging thing that they've had to deal with. So it's useful to maybe think about, well, what have I had to deal with before and what's worked? And sometimes it's hard to know because, we don't necessarily give that a huge amount of thought. We often just get on with it. And certainly if I had €1 for every time I heard that, I would be a rich woman. But yeah, so what does that getting on with it mean? Does it mean that, are you someone that really likes to get a lot of information and understand something? Are you someone who likes to sit down with the pad and really problem solve things and figure it out? Are you someone who'd rather maybe, put things away for a while and give yourself a break and come back at a different time? Are you someone who likes to talk it through with a loved one or get a bit of support that way? So I think it's useful to know, just have given ourselves a bit of space to think, well, what typically works for me, and also maybe what hasn't worked. If there's things that we've tried that maybe hasn't worked. So we kind of interrogate our own behavior first, have a think about our experience and a bit of space to think. I think that can be a useful place to start, so that then we can maybe consider, because there's certain things that we might feel like, well, that helps me, but in the long run maybe doesn't so much. Like if we think about, well, how if we're feeling stressed, we might think, well, I'll have a few drinks and that loosens me up, and then you feel a bit better, and certainly you might feel a bit better in the short term, but in the long term we haven't actually maybe dealt with the thing that's kind of stressed us initially. So if there's things that we can kind of do and problem solve and figure out, because, as human beings, we're often really good at that. We're often really good at figuring things out. We have this big prefrontal cortex that have these big brains that we can figure things out. So how can we do that? If there's a way to kind of problem solve stuff. But sometimes, there's things that just kind of can't be problem solved, or we've done as much as we can to do that. And that's when often we're kind of left with in this space of, well, when we can no longer change a situation, we're challenged to change ourselves. And that's often a space where we might need to stretch ourselves a little bit. Where it's a case of I'm only getting so far with how I usually cope with things. So, and sometimes that can happen when, say, if people maybe cope with difficult situations by kind of keeping busy and keeping active. And then actually that's harder to do if energy is at a premium. Or what if I've always coped by kind of getting on with things independently, and it's actually harder to do that now, and I might need to think about how I get a little bit of help from someone else, and maybe we don't maybe like that idea, or maybe we're not really sure how to ask for that or what that would look like or be like. Or maybe we're having to deal with a new problem like that we didn't have to manage. So an example I often hear about in my clinical time is, maybe worry can be a feature and that can impact sleep, and that can be really hard. So how do I deal with this new problem that I didn't have to kind of manage before? And that's where I suppose sometimes there is this invitation to kind of, okay, how do I maybe add to my toolbox of coping? If I've maybe used a certain few tools, and maybe I need to kind of bring in a few others because, the challenge I'm experiencing is maybe requiring that of me. And that, I suppose, can often involve, these kind of ideas around how do we take care of ourselves, and that can imply things that we do sort of within ourselves, things like our attitude, or how we think about things, how we pay attention to things, and certainly can be a focus of psychological therapy. Often I work with people where there's a bit of space to think about things maybe differently, and do some work around what that might be like. Sometimes it's about how we might mind ourselves in the context of our lives and on our relationships. So we might maybe need to put in some boundaries about what's okay for us, because maybe that's different. Maybe there's things that we're less able to do, or maybe we just don't want to do them anymore because we have a finite amount of time or energy, and what, I'd rather not do that anymore. And how do people maybe assert what they need and say no? That's often quite a challenge. There's maybe something too about taking a little bit of time for ourselves. And that's often a bit of a can of worms, and often we can have an initial reaction against that. Sometimes people can think, oh, I couldn't possibly do that, or I'm too busy, or that's just self-indulgent. But sometimes there's something about how do we take a bit of time to actually mind ourselves. Because do you know what, if we can't do that, then how do we do all the other bits and pieces that we do and that often other people are relying on us for? So, filling your own cup first before you fill others, putting on that oxygen mask first before, you help those around you, as the kind of classic airline safety notice says. So these can look different for different people, and I think it really depends on our circumstances. but I think there's a kind of, you know, a few different kind of areas that we could all probably benefit from thinking about, you know, whether it's how do we cope in terms of, you know, kind of the practical problem solving things that we do. How do we cope with the more kind of emotional things that can come up for us, and for different people that might be different. Some people like to have a bit of space where they can talk or get support. Some people would rather keep things private. There's no right or wrong. I think it's just useful to know what works for you. Um, and I think the other piece as well, you know, because there's a danger of just getting very problem focused in this, of like, how do I problem solve and think things through? How do I just focus on the negative emotions maybe that can come up? And we forget to actually, how do we keep fueling the tank for that actually kind of builds our quality of life? You know, so what are the things that are actually important to us, and how do we keep doing more of those things? What are the things that make us smile, that give us meaning and value, and keep doing those? So that we have this kind of broad, very much individualistic and responsive kind of way of managing, depending on what's kind of coming up for us. And I like to use this healthy mind platter from Daniel Siegel, who's an excellent clinician, to really think about it. You know, we need these various ways of managing to live well. And that's really what it's about. It's not just about how do we minimize the problems, but it's also how do we live well. So, you know, we need the time for sleep, obviously. Like, we're biological beings, we need that time to rest and digest and repair. But we also need time for physical activity. You know, we're kind of in these bodies that are built for movement, and often respond well to activity. And how do we kind of engage in things that give us that not only a health benefit, and I know ILFA does a great job in facilitating things like pulmonary rehab, yoga, really anything that gets you moving that you're going to enjoy, because not only is that good for us physically, but you get that psychological boost from it as well. You know, and we often benefit from this kind of focus time, you know, things that are going to engross you and get your attention and give you pleasure and interest and stimulation, you know. So where are we getting that? We're also social creatures, you know, so who's on your team, who's in your network, who's there to maybe have some fun with. And linked to that is playtime. You know, often playtime is something we think of for kids, but you know, we all benefit from that. And then the downtime, you know, how do we have time to rest and relax? And you know, it's not about being productive or, you know, having an objective. There's, how about those sort of fallow times as well? And with that too, that sort of time in, you know, there might be a piece there about that sort of rest, rejuvenation, but that sort of time in to sort of reflect maybe and think about what's kind of going on for us. So that we can just have that kind of balance, I guess, as much as is possible. So, and with that in mind, I suppose linking this back to what I was saying before with that threat system and that sort of you know, stress system. In this three circles illustration, I think that kind of fight, flight, freeze is very much housed in that threat system in the red there that you can see, you know, and it's about how do we maximize our safety and keep ourselves safe. And that's, you know, this is just the setup that we inherit as Homo sapiens and you know, as human beings. So, and that's needs to be there, and to keep us safe. But, you know, often the threat system, unless we kind of engage with activities to manage you know, our lives, and in terms of doing things that are important, and having time for downtime, can unfortunately take over a bit. So that's where it's important to just acknowledge this sort of these other regulatory systems that we have, that when we're living well and hopefully coping, they can come online a bit more. So the drive system is there in blue, and that can often link to feelings, more positive feelings, and feelings of achievement, and getting things done. And, you know, and we all have that system as well, which is really about set up to get our basic needs met. So that's important. But I think what, you know, my message today is, there's also this soothe system, you know, and this green system, and how do we engage in activities that can help us to manage from that perspective too. And it's this kind of dance between all three of them that I think can help us feel well and maximize our quality of life. And I think from the work that I've done over the years, working with people managing long-term health conditions, what I've noticed is, you know, understandably and absolutely validly, the threat system can get activated because we maybe have a very big scare, you know, in our lives, in terms of a health diagnosis or progression or symptoms. And it's absolutely valid that that threat system goes off, and we maybe have a response in terms of, you know, emotional distress, and that's our body and our brains doing its job to tell us, look, something's not right, you know, we need to do something. But in terms of how we manage that, there's something too about, well, how do we kind of keep driving towards what's important for us in that, you know, and how do we kind of keep doing things that are important and living our lives with meaning, and getting quality of life, and so, you know, being connected with activity that can give us that feedback. And then also, I think there's something about that soothing system too, in the green, so that, you know, it's not just all about doing and being on top of things, and, you know, problem solving, but there's maybe also that space for connection with others, connection with how we can kind of, you know, down regulate a bit, relax, rest, feel connected. And I think from my work, it's often very clear that often the soothing system is the one that gets the kind of least amount of attention, and can benefit from, you know, just a bit more nurture. And the good thing is that although we have these sort of emotional regulatory systems that, you know, we inherited, we didn't design, as I say, hasn't particularly caught up with our evolutionary context. But the good thing is we have what's called neuroplasticity, which means we have that flexibility that we can, with some practice and change, actually change how we might manage, and as I said already, sort of stretch ourselves a bit. And so we know from research that, you know, things like psychological therapy can help people feel better. And, you know, through some practices around not only giving a space to think about your experience, but maybe also learn some other strategies and how you might think about things, or what you might do in terms of relaxation or managing, people can then feel that benefit. And then that their green soothing system can maybe get bigger and get more developed, and we can often feel better in that. We can feel safer, more secure, more able, more confident. So with that in mind, I wanted to give you a taste of a little practice, a little mindfulness breathing practice, as an introduction into, you know, trying to get us into that sort of soothing system, and as maybe another string to your bow in how you cope, because I think, you know, as I say, sometimes the soothing system is the one that maybe can do with you know, a bit of practice. And mindfulness is maybe something I'm sure probably everyone has heard of at this stage. Maybe a lot of you have tried it already, or you already have a practice in terms of meditation. Maybe not, but we'll just do a short practice for the next few minutes, and that might give you a feel, and then that could be something that you could potentially try and practice in your own time, and that could be another sort of tool in your toolbox. So for those of you who are online, I'd encourage you to just take this opportunity, this invitation, to be guided by me in a short breath awareness practice. So when we sit and meditate, it can be helpful to just try and hold yourselves in a posture that feels both awake but comfortable. Um, so if you're happy, I would encourage you to have your feet flat on the floor, your hands at rest in your lap. If you're happy to close your eyes, I encourage you to do that. We often get a lot of stimulation through our eyes, so it can be helpful to just at least lower the gaze, if not close the eyes. And as we start, just invite you to bring your attention inward, to maybe just notice the sensation of your feet on the floor, your body in the chair, just noticing the points of contact, points of pressure of the weight in the chair, sensation of your body, the hands at rest. Just inviting any muscles that don't need to be tense, just to ease. So maybe dropping the shoulders, allowing the face to relax, the jaw to relax. Just noticing as well what might be going on in our minds, noticing any thoughts. As best we can, just allow them to be there. We don't have to engage with them. They're just there. Maybe noticing too any emotional experiences that are going on for us, any emotions, how that feels in the body, and as best we can, just making space for what's here. And as we just gather our awareness into the body, just invite you to drop your attention in to find the breath. We might notice where we feel that in the body, nose or mouth. There's no right or wrong way to breathe. So just noticing the sensation as it is. Sometimes breath can be a bit tricky for maybe obvious reasons, and that's okay. And if that's the case, maybe we can drop our attention to the sensation in our hands, if that feels safer, better. So in this moment, just noticing how the breath is, or sensation in the hands. And the mind will wander. Just bringing our attention back to the hands or the breath. Just gently, without judgment. Just coming back to that home base for attention. Nowhere else to be, nothing else to do. Just allowing ourselves this moment, this space to be with whatever's here as we sit with the breath, with the body. And just again and again, gently bringing our attention back to that home base. And now maybe inviting our awareness to expand out from the sensation of the breath or the hands. Just noting again sensation in the body more broadly. So maybe noticing the feet on the floor, body in the chair, sense of connection, sensation on the skin. Noticing maybe the air around us, the sound around us. Just gently maybe introducing some movement again into the body, and if we've had our eyes closed, maybe opening them again. And just bringing that short mindfulness practice to a close. So yeah, so that's maybe something to try if you're not doing already, or certainly I'd be really interested to hear any thoughts or comments just as we kind of come towards the end of the presentation. But before we kind of finish up, I wanted to just flag a few things. So yeah, I just wanted to just highlight that often people can be making really their level best effort, and things are very difficult. And there's maybe just a few kind of red flags to watch for, that might highlight that we maybe could benefit from maybe a little bit more help, say, or different type of help or intervention. So often I kind of talk about, if people notice that, because it's normal that in life we have ups or downs, and that's just part of being a human being. But if we're noticing that maybe, we're not just having a bad week or two, but sort of the stress is having a significant impact on our lives. So on our ability to engage in what we normally do in terms of work, relationships, at home, caring, whatever it might be, that's a bit of a telltale sign. Or maybe we're having sort of specific problems around cheerfulness or sleep or irritability. It looks different for different people. Lack of motivation, lack of pleasure in things that we normally enjoy. These are things to just watch out for. the odd experience here and there is really normal. But if it's more sustained, and as I say, it's having an impact on our life in a significant way, then don't sit on it, act. Because there's things that we can do about that. It might be a bit of an invitation to sort of think, like I said earlier, just take a step back and take stock and think, okay, what's going on for me? What's working? What's not? Is there anything else I can do here? Um, it might be about, trying some of the other ways of managing um, that I mentioned today. It might be about checking in with specific supports. So your GP is often a really good gatekeeper in terms of access and knowledge about different approaches that might be helpful. And that could be things that are in the community, useful groups that might be around. Particularly if we're talking about things like stress or living well with chronic illness, there are specific group programs like stress control, which is a 6-week program that is excellent for managing stress. The Living Well program is specifically designed for people living with chronic illness, and that's an excellent program that works with both experts in the field, but an expert by experience as well. So you have two facilitators, someone who's living with a condition and someone who's from a healthcare professional background. So those resources are around, as well as maybe psychological therapy. So specific interventions like cognitive behavioral therapy, mindfulness. These can be individual interventions that can give people a bit of space to think and have support and gain emotional support, but also maybe gain some ways of managing in that kind of space, and often quite quickly. Often people don't need to be going to therapy for ages and ages. It can be a case of a few sessions or 6 to 8 sessions, or and some of these approaches are available at low cost or for free. So I have some notes here from around specific services, like particularly say if you have a medical card, National Counselling Service or counselling and primary care, different online resources, and also different community groups, because sometimes there can be a space not just around like that kind of more intervention focus, but more just around, what are we doing and linking with people and activities. So depending on what you might need, that might look different for different people, but and it certainly often is quite different in terms of geographical location, but there are certainly different offerings available. So that's really, I think, all that I wanted to say in terms of slides for today. I will just stop sharing there. And yeah, just thank you for your time and the space to maybe make some points, but really conscious of having a bit of time now if there are any questions or any comments, or if anyone wants to give any feedback around the like mini meditation. I'm all ears.
Well, thank you very much for that, Dr. O'Brien. Really appreciate it. I will say now, I'm not sure if we've cut your sound out. Can we still hear you?
Yeah.
Okay.
Can you? Yeah,
Perfect.
good.
Yeah.
And please just call me Elizabeth. That's absolutely fine.
Oh, okay. Thank you very much, Elizabeth. We don't have any questions that came in. There was one plug I think that I'd like to give for ILFA support groups. So, to your point of kind of connecting in with people, ILFA does run 6 support groups across the country. So that's one thing that you can do. As you had mentioned, there's more information about that on our website. I do kind of wonder, like, specifically around just kind of ruminating and being stuck in your head. Is there a way to kind of break that cycle?
Yeah, that's such a good question because like it's such a thing that we all do, and particularly then when we can have maybe a focus or something that's happened to just go over and over again. And few things we can do with that. One can be, okay, what are we ruminating about and thinking about the kind of content of that, so what's the focus? And then thinking about, okay, what, is there something I can do about this? And there's a kind of classic exercise called like the worry tree. So you kind of break it down into like a flow chart of like, okay, what's the worry? Write it down. Can I do anything about this? Yes or no? If there's things that you can do about it, make a list and see if there's a way to action that list. If there's not, is there a way to maybe refocus on something else? I think have a bit of compassion for yourself in that, naturally it's maybe quite an important thing, and particularly, there's often things that we ruminate about that it just highlights how important they are, whether they're, you know, world events or health or kids or, whatever, it's natural that we might be thinking about them and spending time. But, so that's one thing of just focus on the content and see like, if there's a way to kind of make sense of it. Another thing that's, become, I think, getting increasing traction is more of that kind of present moment awareness. So how can we maybe acknowledge that, of course, these busy minds that we have can kind of get pulled into and loop into worry, and often that's influenced by these sort of threat systems that keeps us focused on things that, are important to keep us safe. So, often we can get pulled into that sort of worry cycle. So we can acknowledge that that's just a part of being a human being, and giving us sort of time and practice, this sort of practice coming back to the here and now. And that's where often that kind of more mindful awareness comes in. Because often what's happening in rumination is it's taking us back into the past, or it's putting us into the future and into the what's going to happen next, and what if, and how will I go, or wherever we might go with it. So instead of being in the past or in the future, we come back to the here and now. And so if we can build practices that can give us that invitation to, what, yeah, you can think about that, but how about come back to the here and now? And that breath awareness, or, some kind of anchor that can pull us into the here and now, it can be really helpful in that. And often we choose the breath because, it's only ever in the here and now, and it's this next breath and the next one which is different from the last one. And I appreciate, and since moving into respiratory medicine, I'm very conscious of breath is often not an easy thing to have a relationship with, but that can be a way in. Another way in that can be core to mindful practice and mindful awareness is sort of the more broad contemplative practice, where it's maybe if the breath is a challenging thing to focus on, then maybe we could focus on movement. We might go out for a short walk and maybe focus on the movement in your body. What's that like? As an invitation to the here and now. Or you might, have heard of things like Tai Chi or yoga or Qigong, and that movement is that invitation to like, okay, let's just focus on this. Let's just focus in on the movement in my arm, or, wherever it is in the body. So that kind of focusing and bringing our attention to the here and now in that kind of more mindful, non-judgmental awareness can be a really helpful way to work with rumination and also help with relaxation.
Perfect. Well, thank you so much, Dr. Elizabeth O'Brien. You
No,
have given us a lot of really wonderful information today. Now we're just about out of time, but before we go, really quickly, I just wanted to mention once again, this is the first of our Let's Talk sessions. We've actually got 5 others that we're working on scheduling. one on oxygen provision, one on exercise and breathing. There we go. One on your entitlements and the patient charter, advocating for your healthcare. One on diet and nutrition, and another on medication. So those will be in the coming months. Keep an eye out for the invitations for those. And just a huge, huge, huge thank you to Dr. Elizabeth O'Brien. Really appreciate it today, and to the generosity of our donors who have provided for us to be able to hold this session today. So thank you so much. Thanks for being with us today.
Thanks so much, Maureen.